Technology is amazing these days. Not only can this phone tell me how many steps I've taken, how far I've run, how many stairs I've climbed, even watches these days, they can tell me my exact heart rate right now. Now, can you imagine if we took this type of technology and made and adapted mobile phones into delivering healthcare services for people living in remote locations in developing countries? What a brilliant idea. It's called mHealth. It's the future of healthcare and it's happening right now. Let me convince you in the next 9 minutes.
Mobile phones have become so popular that they are now a staple instead of a luxury. Instead of sending a letter to your loved one, you can now call them at any time of the day, anywhere you are, whenever you please. Now, we're connected to these devices 24/7 on Facebook and Instagram. Imagine what we can do if we adapted it so that we can deliver healthcare services, especially to those who cannot access them when in need. To start off with a few statistics. 86% of Australians over 14 have a mobile phone, and 14.5 million Australians are on their phone daily. So now you might be thinking, well, Australia is a high-income country, we're developed. What about a low-income country? That's a great question. Well, on average, in sub-Saharan Africa, 80% of the overall population actually own a phone. If we have a look at the graph there, 15% own a smartphone, however, 65% of the population have a cell phone. And one of the most used common features is texting, which will be very important. A good thing to note here also is that this data was collected in 2014. 3 years later, with the current boom of smartphones, I believe that those stats will be higher. So what exactly is mHealth? Well, it is an arm of eHealth, electronic health, where healthcare is delivered through mobile phones and their accessories, such as watches. Now, these can be in the form of text messages, we can monitor physiological conditions, we can monitor physical activity, we can even calculate the amount of energy and calories that we are putting into our bodies. The aim of mHealth is to strengthen the current health system in place in any country. If we have a look at the World Health Organization's system building blocks, you can see that mHealth actually fits into most of them. First of all, without leadership of governance, mHealth cannot be replicated on a large scale. And with healthcare financing though, mHealth can actually help reduce those expenditures if used properly. Health workforce is currently undergoing a shortage of doctors and health workers, so mHealth can help deliver those healthcare services even in places where the doctor isn't physically present. Medical products and technologies, mHealth is a total representation of that. Information and research. With mHealth, anyone with a mobile phone will be able to get the latest updates about healthcare, about infectious diseases, about living healthy lifestyles. And of course, lastly, service delivery. This is crucial. One of the best things about mHealth is that we're able to reach people who are in very far remote locations. And in turn, what we want to be able to do is achieve these goals of improved health, responsiveness, financial risk protection, and improved efficiency. Now, it is important to think, okay, well, low-income countries, maybe they're not so receptive to mHealth because they're not as technologically advanced. That is totally wrong, because 77% of low-income countries have actually initiated at least one mHealth program. Compared to high-income countries, only 83% of those high-income countries have initiated one of these programs. So the low-income countries are very receptive to these programs, and I'd arguably say they're catching up very quickly as well. So the three main reasons for mHealth. What do we want to do and why should we implement it? Number one, we want to deliver health advice to populations living in remote locations. That is crucial. Number two, we want to reduce health expenditure. And number three, mobile phones have become so ubiquitous that everyone will be able to have one. So why not use them? So let's go with number one, mHealth for the remote. mHealth can deliver health support to areas without proper infrastructure. So instead of building another health facility, what if we can tap into these mobile phones and be able to follow up on patients to ensure they're adhering to their treatment, or even use their GPS locations on their phone to find where they are if we do have to go see them. And also, health advice doesn't always have to be given in person. Now, of course, I'm not saying mHealth will replace going to the doctors forever. However, it will be useful for people who live in really remote locations and they just have a worry or they just want to ask a couple questions with a health worker. Instead of traveling hundreds of k's, they can now pick up their phone and talk with them, whether it's through FaceTime or a phone call. And what we can also do is provide psychological support for patients with chronic health conditions. For example, we can't be there 24/7 to help someone quit smoking. But what we can do through mobile phones is provide them with the assistance, such as sending text reminders to tell them not to smoke that much, or providing them with distractions to stop them from heading back to tobacco. Number 2, mHealth as the cost-effective option. First and foremost, we want to reduce inpatient care. That means that we want to reduce those long waiting lists that hospitals currently have. Once again, mHealth isn't here to replace hospitals. What it's here though, it's here to help those who have simple cases where maybe they're just not sure what's happening and they want to see a doctor. If they can contact a doctor through a phone call, if they can text a photo or a video of what's happening, that way the doctor can respond without actually having to do all the traveling. And that will be cost effective, of course. That leads to our second point. It will reduce costs associated with maintaining a health facility in a remote location. Which brings us to the third point, because there is a current pressure associated with healthcare workers with a shortage. Doctors don't want to go out to remote locations. They want to stay in the city. But what if they can stay in the city and still provide their expertise to people in remote locations? That is our ideal way of saving money from the traveling and from having them being deployed there, where they can still perform a lot of their services and give their medical advice all over the phone. And lastly, costs spent on mHealth are minimal compared to the number of patients returning for treatment. For example, with HIV patients, those who got text reminders were much more likely to return for their ART treatment, whereas if they didn't get a text, there would be a 73% loss in follow-up, which is a very high number. Now, number 3, phones are the new necessity. Phones are ubiquitous. That means that if almost everyone has them, everyone can access that mHealth program or initiative. And if we look at the graph there, 80% of phone users use it to send texts. The next one would be taking pictures or videos, which is at 53%. All the way down at the list, at 17%, is get health info. Imagine the numbers of people we could be reaching if we combined get health info with the texting and taking photos and sending them. That way, we'd be able to increase awareness of NCDs, lifestyle diseases, infectious diseases, non-tropical diseases. All of these, we can get the message out quickly. And studies have indicated there is an increased vaccination and consultation attendance and adherence to medication when a patient receives a text reminder. Now, of course, this is not perfect. If it was perfect, mHealth would already be established in every single country in the world. There are several aspects that need a lot of improvement. Number 1, confidentiality and data security of health records. We want to make sure that patient details and info is not available for the public, so that everything is kept safe and secure in the clouds or in servers. Of course, this will also need to take a bit of funding, especially if the initiative was to be implemented in a whole country. Greater studies also need to be focused on mHealth in lower income countries, whilst also assessing the cost effectiveness of these programs. So, for example, we need to make sure that with the culture and context, people will actually use mHealth, especially physicians will actually use mHealth. That way, we know that it's worth the money and governments will more likely be able to invest in it. Talking about governments, we want increased coordination with policymakers so that mHealth pilot programs progress to become large-scale interventions. So all we need, well, there's a lot that we need, but the main ones is regulations through legislations. We also need to make sure that there's administration and coordination and funding. So pretty much what I'm trying to say is we need more research and more research. mHealth is still a relatively new and young kind of arm of health. So to make sure that we are on track and that we are getting the most out of these devices. So to finish off, I want to end on a quote by Sophie Ari, and The idea behind mHealth is so that healthcare will literally be just a call away. Thank you very much for your time.